1. A case manager introduces motivational interviewing techniques during sessions. Which adult learning principle is most directly being applied? A. Learning through repetition. B. Readiness to learn. C. Passive knowledge acquisition. D. Dependence on instructor. 2. When evaluating the effectiveness of a behavioral health program, which tool provides the most objective evidence of outcomes? A. Staff satisfaction surveys. B. Client self-reports. C. Standardized assessment instruments. D. Case manager anecdotal notes. 3. A new case manager is designing a relapse prevention workshop. Which step should come first in curriculum development? A. Writing test questions. B. Identifying learner needs. C. Choosing instructional media. D. Scheduling the sessions. 4. A client with low literacy struggles to complete intake forms. Which communication technique is most appropriate? A. Provide lengthy written explanations. B. Read forms aloud and confirm understanding. C. Ask the client to complete forms independently. D. Provide forms in technical medical language. 5. When documenting case notes, which action ensures regulatory compliance? A. Using client nicknames. B. Recording subjective opinions only. C. Including date, time, and signature. D. Leaving blanks for later completion. 6. A supervisor models how to set measurable goals with clients, then asks the trainee to practice. Which mentoring technique is demonstrated? A. Delegation without oversight. B. Observational modeling. C. Directive correction. D. Passive encouragement. 7. Which evaluation method best measures whether clients can apply learned coping skills in real situations? A. Pre-test and post-test quizzes. B. Case scenario role-play. C. Lecture participation. D. Attendance tracking. 8. In adult learning, what does the principle of self-concept emphasize? A. Dependence on authority. B. Desire for immediate feedback. C. Learners as autonomous and self-directed. D. Strict adherence to curriculum. 9. A CBHCM is reviewing HIPAA regulations. Which practice ensures compliance? A. Storing files in unlocked cabinets. B. Sharing details with client family without consent. C. Encrypting digital client records. E. Discussing cases in public areas. 10. A mentor asks reflective questions instead of giving direct answers to a trainee. Which mentoring approach is this? A. Directive coaching. B. Socratic questioning. C. Peer mentoring. D. Authoritarian guidance. 11. A program evaluation reveals high attendance but poor skill application. What should be adjusted? A. Recruitment process. B. Instructional strategies. C. Marketing materials. D. Class size. 12. Which communication strategy is most effective for de-escalating an agitated client? A. Speaking rapidly to maintain control. E. Using a calm tone and active listening. C. Repeating rules firmly. D. Ignoring emotional content. 13. In curriculum development, which component ensures measurable learning? A. General objectives. B. Clear learning outcomes. C. Flexible schedules. D. Informal discussions. 14. A case manager provides ongoing supervision notes to a trainee. This serves primarily what mentoring purpose? A. Accountability and growth feedback. B. Friendship building. C. Avoidance of responsibility. D. Replacement of training manuals. 15. Which evaluation tool best identifies long-term behavioral changes? A. Daily attendance sheets. B. Client follow-up assessments. C. Initial screening forms. D. Classroom observation. 16. According to adult learning theory, why is experiential learning effective? A. Adults prefer passive lectures. B. Adults value real-life application. C. Adults dislike problem solving. D. Adults resist collaborative tasks. 17. When documenting services, what element is mandatory to meet Medicaid billing standards? A. Case manager's initials only. B. Signature and credential of provider. C. Use of shorthand notes. D. General summary without detail. 18. A mentor encourages a trainee to reflect on mistakes rather than correcting them immediately. Which skill is being fostered? A. Critical self-assessment. B. Compliance enforcement. C. Authority dependence. D. Passive observation. 19. Which evaluation approach provides the most reliable evidence of program effectiveness? A. Anecdotal feedback. B. Randomized controlled study. C. Trainer impressions. D. Marketing statistics. 20. A CBHCM uses plain language and avoids jargon in care planning. Which communication principle is applied? A. Cultural humility. B. Health literacy adaptation. C. Redundancy avoidance. D. Persuasive rhetoric. 21. When building a curriculum, what step follows the selection of learning objectives? A. Conducting evaluations. B. Designing instructional strategies. C. Writing case manager reports. D. Assigning client caseloads. 22. What regulatory compliance standard governs privacy and behavioral health? A. OSHA. B. HIPAA. C. FERPA. D. ADA. 23. A mentor provides positive reinforcement when a trainee demonstrates active listening. This aligns with A. Constructivist theory. E. Behaviorist reinforcement. C. Humanistic philosophy. D. Cognitive dissonance. 24. In program evaluation, which method best measures participant satisfaction? A. Anonymous surveys. B. File audits. C. Supervisor notes. D. Attendance records. 25. Which adult learning principle is addressed by linking training content to clients' prior experiences? A. Problem-centeredness. B. Readiness to learn. C. Experiential orientation. D. Abstract reasoning. 26. A CBHCM reviews agency policy manuals before implementing new procedures. This demonstrates A. Informal mentoring. B. Regulatory compliance adherence. C. Creative problem solving. D. Client advocacy. 27. Which communication method fosters collaboration in interdisciplinary teams? A. Open-ended questions. B. Rapid technical jargon. C. Closed yes-no questions. D. One-way directives. 28. A trainee shadows a mentor during intake assessments, then performs the task under supervision. This exemplifies A. Experiential learning. B. Passive observation. C. Rote memorization. D. Theoretical analysis. 29. Which evaluation method identifies whether training goals are achieved? A. Needs assessment. B. Outcome evaluation. C. Process monitoring. D. Peer discussions. 30. A CBHCM ensures notes are free from discriminatory language. This supports A. Professional ethics and compliance. E. Informal feedback. C. Narrative creativity. D. Record simplification. 31. Which mentoring technique encourages independence in decision-making? A. Micromanaging. A. Problem-solving prompts. C. Corrective scolding. D. Directive instructions. 32. A program includes both quantitative surveys and qualitative interviews. This evaluation method is A. Single case study. B. Mixed methods. C. Pure quantitative. D. Observational only. 33. An adult learner resists mandatory training unless its relevance is shown. This reflects A. Motivation by external rewards. B. Need for practical application. C. Learning style mismatch. D. Passive resistance. 34. Which communication skill is central to trauma-informed care? A. Confrontational questioning. B. Empathetic listening. C. Directive lecturing. D. Ignoring nonverbal cues. 35. A curriculum developer aligns lesson content with state licensure requirements. This ensures A. Convenience for learners. B. Regulatory compliance. C. Creativity in design. D. Cost efficiency.